Apathy, in fact, is a psychopathological syndrome that also points out to the possibility of a brain disease. Of course, it can be the case of schizophrenia, right? The negative symptoms of schizophrenia, or some severe cases of depression. But we should never overlook a case of apathy due to a frontal lesion or a neurodegenerative disease. Now, the patient, when we acquired this image, the patient had an important feature of brain atrophy, mostly in the parietal and the temporal lobes. And I think that the molecular imaging in this case is very clear. So you can see the hypometabolism. Remember that the hypometabolism goes to the blue, to the blue side of the spectrum, whereas the red and yellow are mostly hypermetabolic or normal metabolism. In this case, I would say that there is no hypermetabolism, but there is a very severe hypometabolism in the parietal cortex. So this is a case of Alzheimer's disease. Probably the clinical pattern was a pattern of posterior cortical atrophy, which is not rare in the context of Alzheimer's disease. Now, another thing we should look for frequently is cerebrovascular diseases. I'm not sure in the case of Australia. I know that some of you are from Australia, but in patients in Asia, it's very common to see cerebrovascular disease, and also in Latin America, it's very common. I think it's in the whole world, but some countries have more cerebrovascular disease. And I will show you now a rare case, but then later on, I will show you a very common case. This is a rare case, now just perhaps to point out that, well, the patients don't know if they have to have a common or a rare disease. So it's up to the clinician to study sometimes the rare diseases also. No? This is one of the rare cases I've seen. It was a case of a woman who started with a psychotic syndrome, then moved on into a severe cognitive disturbance, a case of delirium, and finally catatonic signs, a very severe case of catatonia. And the etiology was cerebral venous thrombosis, a cerebral venous thrombosis that was affecting the right lateral and the sigmoid sinus. So this is a venous thrombosis. Remember that venous thrombosis can lead also to ischemic lesions or to diffuse encephalopathy. Now, we should sometimes think of infectious diseases. This is something that I see in my own country. Perhaps it's not common in other places. I think there are lots of cases in India, in Brazil, and in other countries in Africa as well. Fortunately, in Mexico, it's not so common anymore. But where? Well, this is a case in which see a lot of brain parasites. This is brain cysticercosis, neurocysticercosis, and it produces a lot of inflammation surrounding the lesions. Fortunately, most of these cases improve